requesting people to not have additional outside conversation. Excuse me, no additional outside conversation, please, sir. Hello, all of you beautiful birthing people. Welcome back to my channel. My name is Elizabeth, also known as Nurse Zabe, here on YouTube and Instagram, and I'm a labor and delivery nurse and certified childbirth educator. And today I am bringing you the next video in my series, 10 things you didn't know about, or 10 things nobody told me about. And this one's going to be about cesarean birth. So this was always going to be my next video, but on my last video a lot of people commented, hey, like, can you do one about C-sections? And of course, abdominal births, totally gonna be my next one, because we know that in the United States 1/3 of births come through the sunroof, is one way that we like to put it. So if you're hearing rustling, if you're hearing little noises, I have a little baby here hanging out in her bassinet on the floor, kind of using it a little bit as a playpen. She's sitting up in there because she doesn't nap and she doesn't sleep, and I have no other time to film this when I don't have other kids. So she was down for a nap, and by the time I got my camera set up, she was awake. So she's gonna play. Without further ado, let's go ahead and jump into talking about cesarean births. Now, you are going to hear me refer to them as cesarean births, abdominal births, cesarean sections. My big point is that they're births first and foremost, and that this is a totally beautiful and wonderful way that your baby has come into the world. And I don't want to invalidate what you're feeling about it, but to me, a cesarean birth, abdominal birth, a birth is a birth is a birth, and they're beautiful. So the first thing that I want you to know about cesarean births that I think a lot of people are unaware of, and what happens to them, they're like, oh my gosh, what's happening, is the itching associated with the medication that you get for cesarean birth. So in a lot of places you get medication in your spinal or bolus up through your epidural that gives you really good pain control for about the first 24 hours. In my facility, this is a Duramorph, which is like a morphine derivative. It works great, but it has one really annoying side effect: itching. Most people get a little bit itchy. Some people get crazy itchy, like so itchy that you're digging under your skin to get the bugs that feel like they're crawling on your face, on your body. A little mild itching, wouldn't worry too much about. We definitely can give you medications to help with that. But if you're having itching that's so severe that you like can't stop scratching, you can't sleep, we definitely want to give you medications to help with that. So certainly let your nurse know. But this itching is really, really normal. It is not an allergic reaction. It is just a side effect of the medication. I have had people say, you know, I don't want the Duramorph because the itching was so bad last time. And they are given like a PCA pump after delivery, so a button that they can press to give themselves medication through an IV. It doesn't work as well as the Duramorph. The people who decide that, totally a valid choice if that's what you want, but the Duramorph definitely works better for this post-cesarean pain. The nice thing is this itching is self-limiting to about 24 hours. That's about how long the Duramorph works. We have medications we can give you if you're feeling super itchy, so definitely let your nurse know, but don't freak out that you're allergic to something or that something's wrong. Just a normal side effect and not fun, but definitely better than being super painful, in my personal opinion. So the next thing that I want to talk about kind of still goes off of that Duramorph. So if you are laboring and you have an epidural, your anesthesiologist more than likely will be able to take that epidural and give you more medication, including that medication that can cause the itching, and bolus up your epidural so that you do not have to sit up and get a spinal as well as an epidural. Now, sometimes if the epidural is not working great, that's not an option, but that is the nice thing about having an epidural, is that it can be converted and used for a cesarean birth most of the time. You can have an epidural placed and potentially not even run medicine through it, but just have that epidural in case you need it to go back for a cesarean birth, so that they can quickly give you medication through that instead of having to sit you up for a spinal, which would take a little bit longer and in an emergency is not going to be possible. Now, speaking of emergencies, this is number 3. And I want to say this without invalidating anybody's birth experience, because I was not there. I don't know what's going on. But a lot of people will say that they had an emergency cesarean birth. And what they truly mean is that they had an unplanned, maybe even an urgent cesarean birth. But in the medical field, an emergency cesarean birth is actually fairly rare. Most of the time, even if you have an epidural, in a true emergency, we're going to still need to put you under general anesthesia so that we can get that baby out super fast. But it really is like the baby's heart rate is down and it's not coming back up. You are bleeding and we need to go now. The cord has prolapse and we need to go now. Now, there are definitely instances when we are looking at a fetal heart rate tracing and we are seeing recurrent decelerations in the heart rate that are coming back up to baseline, and we're thinking, based on how your labor is progressing, how baby's tolerating it, what baby's showing us with their heart rate, this could become emergent if we wait. And so we're gonna move ahead with a cesarean birth for the safety of you, for the safety of your baby. But most of the cesarean births where people say that they had an emergency C-section, it was just unplanned or urgent. And I wanna say this, again, not to invalidate your birth experience, but maybe to give a little bit of perspective and let you know, like, yes, it was scary. Yes, it was intense. Yes, you made the right decision, but it wasn't truly emergent, because those are honestly pretty terrifying. As a staff member, having to put somebody under general anesthesia, which we rarely do for cesarean births now. We have the spinal and bolusing up the epidural for almost all cesarean births, but with the true emergency, when we need to get that baby out in a matter of minutes to save baby's life, we can do it using general anesthesia. So now, speaking of anesthesia, your anesthesiologist is going to be your BFF in your cesarean birth. So if you have been laboring, or even if not, the nurse that's preparing you for your cesarean birth more than likely is going to be circulating the case. So their job is kind of to be the gopher for the people who are sterile. Their job is to be charting on the computer, doing the counts, getting medications as needed. But they are not going to be the one who's like right up with you like your labor nurse would be all the time. That's where your anesthesiologist comes in. This is something that they enjoy doing, getting to talk and be with patients while they welcome their babies into the world. So the anesthesiologist is going to be sitting right by the head of the bed where your head is. They're going to be giving you the medications to make sure that you're not having too much nausea, to help with your blood pressure, to help with bleeding, perhaps if we have any issues with that. They're also going to be the ones telling you what's going on. And they're going to be the ones who are encouraging and reminding you to take pictures, helping you if you're feeling nauseated. They are going to be your best friend. They're going to be the one who's helping keep you calm in the moment. As the circulator, I also really try to be present for the birth as much as I can, but obviously at that moment I am more in the medical side of it, and maybe not getting to be so much on the social, beautiful side of it that I love as well. Become BFF with your anesthesiologist. Know that they're there for you. Know that they've got you. Let them know what you're feeling and what's going on, because their goal is to keep you comfortable while we help bring your baby earthside. So speaking of people who will be sitting up by your head in your cesarean birth, most facilities are going to have a limited number of people who can be in the operating room, because while it is birth, it is also a surgical operation where we have an increased risk of infection. We need to make sure that we're keeping things sterile, things of that nature. So a lot of places will just have one person be allowed to be in the cesarean birth with you. Normally this will be your partner or your mother or somebody who's going to be there with you and there for the baby. So typically what happens is when we're going in for the cesarean birth, and this might not be all places, but everywhere that I have personally been for a cesarean birth, so definitely check with your facility, they'll have you come in and get everything set up and get you numb and get you draped and get everything ready, so that when we bring in that additional support person, the room is sterile and ready to go. There's nothing that they can touch, and we can just kind of guide them to their chair so they can sit and hold your hand and keep you feeling safe and calm. So again, that's where the anesthesiologist is going to come in, being your BFF before your support person gets in there. Now, another thing to kind of keep in mind is that while yes, this is a surgery, this is also your birth. So requesting people to not have additional outside conversation. Excuse me. No additional outside conversation, please, sir. Just like that. No, you can be nicer than that. I should be nice to you, huh? You trying to crawl. You having a hard time. So not having additional outside conversation, asking if you can perhaps have a clear drape so that you can witness the birth of your baby, which is so awesome if you're into it. Requesting to have some music playing so that that can kind of help keep you calm. The other thing that you can definitely request with your cesarean birth is skin to skin in the OR. This is a great way that you can get baby onto your skin, start with that bonding immediately, and also potentially even breastfeed in the OR. Sometimes it's a weird angle, but it can definitely be done if baby's interested. Make this a very like family-centered cesarean birth that is about you and about your baby coming into the world, because that's why we are all here, is to welcome your baby into the world. One thing that I think a lot of people are not super prepared for with a cesarean birth is the fact that there's a lot of nausea and vomiting associated with cesarean birth. Doesn't happen for everybody, but we will give you medications before your birth, sometimes by Citra, which is like this sour grape tasting liquid that people don't like. Pro tip, put it over ice, take it like a shot, and it tastes so much better. We'll also maybe give you some Zofran through your IV. A lot of places even have nausea protocols. We have people chew gum immediately post-op, start drinking pretty quickly post-op to actually help stave off that post-op nausea and vomiting that can occur. But during your birth, sometimes the biggest cause of nausea and vomiting, just like when you get an epidural, the spinal can drop your blood pressure. Definitely let that BFF anesthesiologist know. They can give you medications to help with your blood pressure, give you more nausea medication, get you a cold wash rag for your forehead. And if you do throw up, what you'll do, because you're gonna be lying pretty flat, is put your head to the side. They'll have a little basin right here. You'll throw up and they'll also suction it out of your mouth. So it is miserable. I know we don't want you to vomit, but if it does happen, I want you to know that it is kind of a normal side effect or complication with the cesarean birth and the drop in your blood pressure that sometimes is associated with it. Speaking of that drop in blood pressure, another thing that can kind of happen that is super, super normal is that you might have the feeling like you can't breathe. And that is a really scary feeling. And it's not that you can't breathe for the most part. It's like you're numb to a point where you can't feel that you are breathing. So what I want you to say to yourself if this happens is I want you to have this mantra, because I want you to say it out loud. If I'm talking, I'm breathing. If I'm talking, I'm breathing. If I'm talking, I'm breathing. Because if you're talking, you are breathing. I know it's silly, but it really does help. The other thing to kind of keep in mind too, with that numbness that you're feeling, you should not be feeling anything sharp or anything painful, but you will feel tugging or movement. One of our scrub techs uses this analogy. I'm not sure if it's gonna bode well for you, but I think it makes a lot of sense. It's kind of like they are rummaging around at the bottom of a purse to get something out. That's kind of what you feel like. You're kind of the purse. I don't know if that works for you, but it kind of makes sense. So you might feel movement. You will feel tugging when the baby's coming out. You might feel some pressure, but you should not feel pain and you should not feel sharp, and they ideally should not start your cesarean birth until you're not feeling those things. Now, sometimes that means that in an emergency or moving towards an emergency situation, if we're not getting you comfortable, then we will consider general anesthesia, but we don't want you to be feeling things that are painful. During your cesarean birth, if you have been pushing, if your baby is at a really low station, super engaged into the pelvis, sometimes there is almost like a suction that's kind of keeping baby in your pelvis because it's down really deep, and the doctor needs to go in and break that and get their hand to bring baby's head out. So sometimes they will ask a labor nurse or another doctor to go in with a sterilely gloved hand to actually put their hand on the baby's head through your vagina and gently elevate the head so that the doctor is able to get your baby's head out. So if that happens, you're not gonna feel anything, good news, and we're gonna make sure that we get your baby out safely. But sometimes if you've been pushing for a while, that might be something that needs to occur to get your baby's head out of your pelvis. We just have a few more, so she's gonna be sitting on my lap. I hope that that's okay. And you're not too distracting. So, after your cesarean birth, things I want to talk a little bit about are your incision and getting up. So you're going to get up pretty soon after your cesarean birth, definitely on that first day that you've had your cesarean birth. So post-op day 0 is what we call that. You're going to get up to the chair, maybe even walk in the hallways. And getting up and moving is really important. It's also really normal for things to feel really tight, to feel like, ew, if I stand up all the way, it's going to pull at my stitches. It's not, I promise you, that's just kind of what it feels like. Post-op day 1, so after that Duromorph has worn off in those first 24 hours, that tends to be the day that we're most painful. And staying on top of your pain medication is important. If we let that pain get to too high of a value, it's really, really hard to bring it back down. So if you can ask them to regularly bring your Tylenol and ibuprofen and then supplement with a narcotic as needed. Some people do fine with no narcotic, and some people need narcotic to deal with their cesarean birth pain. And you just need to do what works for you so that you are able to start taking care of yourself and taking care of your baby. Now with that incision, the things that are really normal right afterwards is that you can't super feel it, and sometimes that takes a while for that feeling or that sensation to come back. It's important once you go home, you can start even before the 6 weeks, but definitely after the 6 weeks, that you start doing some scar mobilization after the 6 weeks, start doing some scar desensitization experiences. So rubbing different fabrics and textures over that scar area will help it start to feel more like it did before. One thing that I really recommend in the hospital is taking a picture of your scar so that you can see exactly what it looks like as you're being discharged, so you know if there's any differences that might mean that you need to go in and be seen again. So the things that we worry about with a cesarean birth scar is that we could potentially develop an infection in that area that needs to be treated postpartum. So things to watch out for: if it gets red or hot around the incision, if the incision opens up at all, which would not be super fun, right? If we're noticing any drainage or discharge from the incision, particularly like pus colored or foul smelling. If you develop a fever, those are all things that could be indicative that we have an infection that needs to be addressed. So if you've got that picture to go off of, it's nice to be like, okay, does this look normal, or is this different than what it looked like before? Now, it is really normal immediately post-operatively that we have a little bit of drainage that's a little bit, we call it serosanguinous, so a little bit like bloody and just clear mixed together. It also can be really normal to have a little bit of bruising around your cesarean birth site, but if you're noticing major changes, very different levels in pain going out from when you go home, that's definitely a good time to call your provider. One of the last things that I want to let you know about cesarean birth is we used to think, once a cesarean birth, always a cesarean birth, but that's not the case anymore. Vaginal birth after a cesarean birth is encouraged if that's a route that you would like to take, but if you want to do a scheduled repeat cesarean birth for a subsequent pregnancy, that is also an option. You can choose and decide what you feel like works best for you based on your clinical picture, based on how you feel your birth went, based on talking with your provider and figuring it out. Now, not all providers are going to be VBAC friendly providers, and some hospitals don't perform vaginal births after cesarean due to staffing issues. So finding a provider that is both supportive and a facility that is ready to take care of you if you decide that you want to have a vaginal birth after cesarean is really important. I have a whole video, it's really old, on VBACs as we call them. I also did a webinar that's pretty recent with Dr. Little over on her Facebook group, so I'll link to that if you want to join that to get that webinar, because that information is a little bit more up to date than the one I did a few years ago, because information's always changing. But I love supporting people who want to have VBACs. I also love supporting and making a second scheduled cesarean birth a lot more pleasant of an experience than the first, because when you have labored for hours and hours and you've got no sleep and you finally have that cesarean birth, you are so tired and exhausted and it's just a lot, versus if you come in fresh in the morning for a cesarean birth and you haven't labored, it's a lot easier on your body. Are you getting grumpy? Yes, you're gonna give mommy kisses. Oh, okay. I think we are hungry. Are you a hungry girl? Well, let's finish this up. So the last thing that I want to let you know about cesarean birth is, I've already touched on this, it's birth. Birth is birth is birth is birth. You had a baby. You grew that baby for 9 months. You did everything in your power to bring that baby out into the world safely. And you are an amazing and wonderful parent. Your baby is so lucky to have you. You do not need to justify or explain your birth to anybody. You made the decisions in your birth with the best information that you had at the time, and you are doing an amazing and wonderful job. It is okay and it is normal to be disappointed if that wasn't the birth that you were hoping for, while still being very happy that your baby is here. You are definitely allowed to feel two feelings at the same time. So I want to let you know that you are awesome and you are a rock star and you did it. And without further ado, I must go feed this very grumpy, sassy little girl who did pretty good. I think we give a round of applause to Rosie. Until next time. Bye guys.